So this group of people is actually waiting to be seen. This is our triage process. These are the newcomers, and they will slowly walk in as they file in. Akam, 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 akam. They slowly file in to see the doctor. They will be put in the waiting area over here. So they follow a very organized path. It may not be fancy, but it definitely is efficient. Akam. And this is the waiting area right here. As we can see, we have a variety of people waiting to be seen. We don't know exactly what their ailments are. Some of these people have never seen a doctor in their lives. Some are extremely healthy. Some have conditions that may not be curable in this area. How's it going?
We're treating so far 416, and there are over 1,500 registered. And as you see, all these outsides, it seems like we haven't even got anywhere near halfway for the number of patients we're seeing today. A lot of them are getting treatment, and those who are not getting a treatment, actually we have a plan in order for them to type of a treatment that can be offered. And we have referred some patients actually who are acutely ill that needs to go to hospital with heart rate of 150s, difficulty breathing, and with advanced stage of TB, and patients who are in sepsis and dehydration. Incredible how many have been sent that was deemed just sitting at home waiting to die. Every time I go back to Ethiopia, I'm greeted by death. And the last one was a friend of mine who was coming for the celebration of the high school that we opened, so that his child would be inspired by what we've done. They were coming from the city, they were walking on a sidewalk, and he got hit by a car, and from just a simple injury, he didn't survive. So that was the day when my wife and I decided at the time to actually build healthcare in this community. When God gave me that opportunity of becoming a doctor, unfortunately that opportunity took me away from the country and the society that I initially wanted to help. So my mission was never fulfilled until I go back and reconnect with what really got me into wanting to be a doctor to start with, a lack of care in that community. Interestingly, that lack of care did not get better. If anything, it got worse over 30 years.
Or when you look around in Ethiopia, the healthcare facilities are very minimal. Like, we decided to build this facility in Arsinagele because they have no healthcare facility, hospitals around here. They have nowhere to go. So we decided maybe if we did build a hospital in Arsinagele, it will serve the area here.
In Ethiopia, 90 to 95% of resources located in the major cities like Addis. That majority of resources only located in a place where less than 5 to 10% of the population lives. It's actually worse for the people in the region of Oromia. You have less than 1% of the resource available. There's a disparity of care here. When you look at Nagele RC, this is locations that is in the heart of the absolutely a needs-based community. In fact, a year before we made a decision to build a hospital in Nagele RC, a simple disease as a diarrhea, a dysentery, killed over 280 children with dehydrations. Imagine, nobody should be dying from dehydration in this day of age. So we decided to build it in Nagele because that is where the need is the most.
This is really an amazing project that's going on to see a new hospital coming up in the center of town of RC Negele in what was a trash area that Dr. Gudata has helped to transform to care for the people here in RC. It's going to cover a population of 70,000 people and about 10 kilometers radius from around this site to bring them much needed healthcare services that have been a huge gap up until this point, or up until the hospital is finished. Very, very exciting, and the dedication and commitment. Many of the workers that you see, the young women and some of the young men carrying the stones to support the foundation, are students at the local secondary school working for their summer vacation to make some money for their clothes and their books for school next year. Some will stay here in RC Negele, others may have opportunities to move on elsewhere. And hopefully maybe another Gudata Hinika will arise from this group.
What is a library with no books? Darkness. What is a library with books? It's light.
Desta, what did you learn in summer school?
When we teach the communities or the kids, we indirectly are building or establishing the self-confidence.
It's absolutely incredible to come to this building now, nearing completion, when less than 3 years ago we were standing downstairs on an open foundation with sticks to support, cinder block, and cement. Unbelievable to see the change and the transformation this has already created. The mud road that ran in front of the hospital is now a cobblestone street. When we came, there were children who were gathering drinking water from mud puddles in that road, a woman who was washing her clothes in another puddle. Just hard to fathom the kinds of change that this hospital is bringing already to the area. This is going to serve a catchment area of nearly 1 million people or more under Dr. Hinike's vision. And he has this incredible facility with OR capacity, delivery room capacity, an extensive outpatient department, and the capability of really serving the majority of the needs of the people throughout the surrounding area. Congratulations, Dr.
People coming here, they need to feel a presence of something unique. You need to have a health center, health post surrounding the small community hospital of 25 bed or so. And this can actually be on all different directions of Negele. And eventually Negele as a referral center for this small hospital and health center can take care of a lot of complex issues, and it becomes a teaching institution for the society there. And of course, there will always be a case that will be referred out, and that's what we'll be looking to Adamas and Addis, so that there's a connectivity as we care for the society. We have sent 2 ambulances stationed at Negele Hospital and go to all these health centers. We have created a mini transportation mechanisms as well as a collaboration between these health centers, and it's a beginning. It's a great beginning.
There are profound needs in the field of healthcare and education, and for this I think what has been done in RC Negele area has been encouraging and something practical that as a community we can build on.
So today we are at a greenhouse or a landscaping company to purchase trees for the hospital's healing garden and food garden.
The healing garden is really, it's an environment that creates a peace and tranquility for the patient and the family to come out, where actually a social worker and and case worker, and someone that actually would teach the patient and the family about the preventive care, about reassurance of their care in the hospital, and more importantly, helping them understand the disease process, an environment that is more of at ease as opposed to being in a hospital.
He wanted to handpick the plants so that the campus would look beautiful.
What are we looking at right now?
We are looking at the health college right here. This is the school that would have nursing, public health, midwifery, laboratory, and radiology initially for the first 4 years. Once we graduate our first batch, and then we plan to actually start medical school right here. By then, the college should be, the hospital should be running very seasoned with a fully staffed physician and nursing. Imagine in 3 years having this dream come true proves to you that when you only dream and work toward the dreams, anything is possible.
It's impressive that Dr. Hinneke was able to really create this type of facility in a remote area such as this. This facility has completely transformed this region. It's impressive, and seeing the growth of the region and the level of sophistication that's coming here is going to change the lives of the people in this area forever.
Because our hope is to duplicate the same model of care throughout rural Oromia and the rest of the region that might need it.
Have a long life still.
Galatoomii baay'ee si jaalladha.
The success is when the society that needs medical care gets what they deserve.